I'd
Yeah,
like to know.
no,
So
the use of the ease of use was what I enjoyed the most, and just the quickness. Literally, I just prepped both boxes, made sure my contacts were open, and
mhm,
I just slid the matrix. And I kind of followed your video where it came at a steep angle,
right.
and of course pushing the wedge in place. I just
Hmm.
had to push with a bit more pressure just because it was a large wedge, and
Right.
used to using like medium or small.
Yeah. Oh,
I just
okay.
had to apply a bit more force. But the embrasures were great. The contacts were great. When I went to remove it, because it was just such a large wedge, I had to really, kind of just tug at it.
Right.
And then the only thing I was hoping was that I could just sterilize and reuse it. But then when I was
Oh, yeah.
removing the wedge, part of the band just came off, and I was like, oh, okay.
Uh, oh, you were trying to, you were going to try to, but you don't reuse the typical ones, the traditional ones. Right. Yeah.
No, no, it was
Yeah.
just
So it's,
a cool, unique appliance that I just wanted to use it as many times as I could. Of
oh,
course,
yeah.
remaining infection control and all that.
Right. True.
Yeah, yeah, but it was great to the point where I wanted to keep it.
Keep it. Okay.
Yeah,
Okay. Good. I'm
yeah, even
happy.
my assistant, because I was just like, "Hey, I'm gonna try this new thing, put away the other stuff. I just need the ring and the ring placer, and we're gonna use this." And then when I just did the normal prep it, and then I slid it in place, then
Uh,
I was like, "All right, give me the double flat plastic." And I just opened it up, made the little diamond on the outer surface, like the buccal
uh,
surface. And I was like, "Okay, just pass me the ring." And I just placed it in, and then I was like, "Ta-da!" And she's like, "That was really fast." And I was like, "I
yeah.
know, right?"
That's awesome.
Yeah, and I was like, "Yeah, we don't need all these little separate things and all that, and, like, if it kinks, it bends, it's like, you have to start all over again." This was great.
True. Yeah. Good. Did you use that feature where you could like pull on it, and make it taut a little bit?
Yeah,
You did
I
that
did do
too?
that. Mhm.
Okay.
It was great.
You noticed it actually like pulled it and made it taut?
Yeah, it made it a lot more, flush to the proximal box surfaces, so that way I didn't
Okay.
have any open margins or anything like
Nice.
that.
Yeah.
Um, but yeah, overall, I was really happy with it, and the patient was happy with it because it was much faster than, putting the matrix in, holding it down, slipping the wedge in place, and then if, the wedge is too big or you're pushing it through, it moves the matrix bands out of it, and you're like, "Oh my god," you just
Yeah.
take it all, do it all over again. This one was I really appreciate the fact that it was all in one.
All in one. Yeah.
So like
The
nothing moved.
right, good. Yeah, that's the idea, right? When you're pushing the wedge in, the bands start to move.
Right. And it's like, oh my God, it's like I have to keep a finger here, keep the suction in here, and then the patient's gagging, and it's like, this is too much.
Right.
Yeah.
Do you get that a lot? Do you get a lot of like back to backs in your office?
Yes, I do.
Yeah. Oh, okay. So then
Yeah. And me
I need to
specific
send you more.
yeah, that would be great.
Yeah.
Me specifically, I do a lot of quadrant dentistry as well too. So I'm working on multiple teeth at the same time, multiple quadrants, multiple even upper lower arches at the same time.
Mm,
So it
awesome.
just using the BiBand would make my appointments a lot more efficient time-wise as well too, and patients would be happier, less time in the chair, less thing going inside the mouth.
Right, for sure. One tooth at a time. So they like want to
Mhm.
take, I have that option of and it's like
Yeah,
50-50. It seems like keeping both bands in or doing one restoration, taking one band out and then doing the other. But you kept
mhm.
both bands in the whole time, right?
Yeah, I kept both bands in the whole time, I burnished the contacts, and it turned out really, really well.
So you typically do that? You would keep both bands in like on regular section. Okay. And the
Mhm,
contact was good.
mhm. What I liked about the BiBand too is that because the buccolingual, it's kind of like a bit wider as well too. Because I always isolate with cotton rolls, and it
Hmm.
kept cotton rolls in place, cut the tongue out the way, the cheek out the way, so it was like
Ah,
really good isolation, like a good field of vision.
mm,
So I know that okay, things are sterile, things are dry.
yeah. Yeah, I actually didn't even think about that. Are you talking about the arms part? Like it kind of like you could tuck the
Yeah, like
cotton
little
roll
wings.
underneath.
Yeah, so it was
Right.
great. I always usually tuck my cotton roll underneath the wedge, and then the ring helps,
Mm,
keep things down. But sometimes the tongue is just strong; it can lift up the cotton roll.
yeah. Oh,
So
that's interesting. That's something that I didn't think about before, like the isolation, the ability to push the cotton roll down too.
and it keeps it in place, and the patient's, like, not moving because it's like, "Oh, it's this big thing."
Yeah.
Not
Oh, yeah.
overly big.
Right. I wonder if you could attach something to the end of the wedge, kind of like a
Oh,
maybe
yeah, kind of like a barrier thing.
maybe you invented something. We could add it to the buy band. I'll
That
put
would
your
be
name.
neat,
I'll put
yes,
your name on the patent.
right.
Yeah.
That'd be great.
All
Yeah.
right. I know you probably had a long day at work, so I don't want to keep you too long.
Yes, yeah, I did. But it would be definitely short if I had more BiBand so I can use them.
Yeah,
Yeah.
I'll get you more. We got to rush because we have a lot of people trying to order them.
Yeah,
And
I even sent your link to a couple of my girlfriends. Be like, hey, I just tried this thing out. You should definitely fill out the survey, and you get free samples. Definitely give it a try.
yeah, you sent it to your friends?
Mm-hmm.
Okay, good.
So we'll see if they fill out the survey.
Yeah.
I'll go in
Oh,
there, just fill it out, and get more free samples.
are they in California too?
Yeah,
Okay. Yeah, I could send it to them. You let me know their information if they didn't do it. I'll just
yeah,
send it to them.
yeah, absolutely.
All right.
Yeah.
It was nice talking to you. Nice
Yeah,
seeing
I
you.
know. Thank you so much for including me in this adventure, and
Of course.
I really want to just thank you for coming up with it. Just the time that I used it was swift, easy to use, didn't break a sweat, and
Good.
it was a smooth appointment overall.
Amazing.
Yeah.
I appreciate it. Yeah, I mean, you were like one of the early adopters too, because I spoke to you years ago when I was still in development phase for it, where it
Yeah,
wasn't
I know,
as
and I kind of was wondering about you here, and I was like, I wonder if you ever took it to the next step because I really liked using it. The idea behind it is great
yeah.
as well too.
Do you
I was
think
even telling
like
my, I was like, I wish I came up with the idea.
yeah, I was obsessed. I used to hold the BiBand with everywhere I went because I
It
was like
looks
trying
like
to work. I'd have it in my pockets and yeah, just trying to like figure out the little design changes, little tweaks that needed to be made. Like
yeah, and that way too, I don't have to know. I no longer have to really rely on using a Toffmeyer. If I'm
mm,
three surface and a two surface right next to it, because sometimes the assistants struggle putting together that Toffmeyer. And sometimes
right.
patients can't withstand a really long metal rod sticking out the mouth.
Oh yeah, yeah.
Or the lip also can push it up, and then the whole Toffmeyer starts lifting.
hmm
Oh my god, I have voids.
Yeah, and then you have to depend on the wood wedge too, right?
Yeah,
Like you
to
have to like
really get
jam it
that
in
in
there and it
there.
slides back out so you don't get a good contact and then the
Right,
the
yeah.
contour is straight. So
Oh,
then
the other thing I will say too is I'm glad because because it's all built in one. Usually either sectional matrix or Toffmeyers, they cut the gums.
right,
This
right.
didn't, hurt the gum tissues at all. There were no
Good.
lacerations or things like that, especially on deep preparations. The gums.
Right. Yeah, people have asked me like what about deeper preparations?
Mhm.
And the design is like a hollow wedge, right? And then the band goes right to the end of the wedge. But the wedge is what's touching the gingiva first. Like the band is still high of the wedge. So when
Mhm.
you're sliding it in, it's the wedge that's touching the gingiva.
Yeah, not the
And
band.
then this goes over the papilla, like the hollow shape of the
Right.
triangle of the wedge. So
So
you
I
still
definitely
get into those.
because there was a lot of less bleeding than after I took everything
Hmm.
apart.
Yeah. Did you take the bands out? Maybe I didn't tell you that in the instructions also, which I should be including, like the actual removal of them. It would be good to detach the bands from the wedge and then like
Oh,
just
okay.
take the band out separately and then slide the wedge out.
Yeah, okay.
Because
Yeah,
then
I was
you'd
just trying to pull the whole thing out all
pull
at
the
once.
thing out. Yeah, I mean you could, but I think maybe there's more likelihood of cutting
Oh yeah.
versus like taking out the band first. Yeah. So, but you were successful with it the way you did it.
Yeah.
Good.
Yeah. Well, thank you so much for including me on this.